My name is Randy Kring. I'm the chair of the Concord Board of Health. Thank you for being here for the Concord Board of Health meeting today on Tuesday, June 18th, 2024. So I'll go ahead and call the meeting to order. And we'll do a roll call of the Board of Health members who are present. So I'll start. Randy Kring, chair of the Board of Health.
Dottie Bernard.
Great. And then Kurt.
Kurt Herman by Zoom.
Excellent. All right. So we have a quorum with 3 members of the board present. And we'll go ahead and start with the agenda. So the first item on the agenda is approval of the minutes from last month, May 21st. Unless there's any suggestions or edits, I would welcome a motion to approve the minutes.
Yeah. I move to approve the minutes.
Excellent. And a second.
Motion.
Excellent. All right. All in favor?
Aye.
Aye.
Aye. Excellent. All right. So unanimous approval minutes from last month. Next on the agenda, we have the 61B Walden Street subdivision hearing.
And I think Robert Melvin from Stamsky is here.
Yes, I'm here on Zoom. All right. Should I begin?
Yes, go ahead.
All right. So my name is Robert Melvin with Stamsky and McNary. I'll be representing the applicant for this preliminary subdivision at 61B Walden Street. I'm just going to start by sharing my screen here. All right. All right, so here we have a 2-lot subdivision, and this is a preliminary plan. So preliminary plan isn't required for subdivision approvals, but it is recommended for projects where you're looking to take certain waivers for the planning board. So that is why we're here today. We are taking a handful of waivers, most notably, as opposed to designing a cul-de-sac loop here, we're designing a road with a T turnaround. And so we're providing on-site sewage disposal systems to serve the 2 new lots here and on-site drainage. We did go out to the site, I believe it was earlier this year, if not during the winter. And we conducted soil evaluations with Mike Fanuel. So the soil here is Windsor sandy loam, which is comprised of a sandy loam sub-layer, followed by a sea layer, which is comprised of very loose gravelly sand. So we dug about 10 feet down in our test pits, which are denoted by these symbols here. We got about 10 feet down in all the pits. We found, just clean, nice sands all the way to the bottom, and no indication of groundwater as far as we dug. And that goes for the same here at these 2 pits. And let me just take a step back and talk about the excuse me, the topography here. So here we have Walden Street, and this is our new subdivision road here. So from Walden Street to this main area where we have the proposed dwellings and proposed septic systems, it's a fairly flat area. But just as you get past this point at the very end of the dwellings here, it's actually a very steep drop toward the bottom here. And if you're looking at the far end of the lots here, it's the same thing. We have a very steep drop where the lots sort of converge and water is carried away off to the north side here. So like I said, we dug some test pits down here. This was mainly for drainage purposes, but we found the same results, nice clean sand about 10 feet deep, no indication of high groundwater down there. And so we haven't perked these areas because these are not planned for septic systems, but we did get some percolation testing up on top of the ridge. All 4 tests were unable to saturate. It just means the water's flowing through it very, very quickly. So those are the soil conditions we're dealing with here. Very suitable for septic systems. The systems are very generally sized for about 5 bedrooms. They haven't been fully designed yet. That will be coming at a later stage. But yes, so we're designing for about 5-bedroom septic systems. They're going to be most likely conventional leaching trenches. What's not shown here is water supply. We are going to be tapping into the main on Walden Street to provide water for these 2 dwellings. And like I said, we have some areas of proposed drainage down here at the bottom of the ridge. We've got a few areas up top next to the proposed road, also for drainage. And I believe that is it. I'll happily take any questions anyone has.
I have a question, just pardon my ignorance, but the reason that this required a hearing, can you remind me?
It's a state reg that boards of health approve subdivisions.
Got it. Okay,
Specifically, my assumption is that they have water and septic or sewer.
Right, that was my understanding too, and I believe in the Concord subdivision regulations for a definitive plan requires explicit Board of Health approval to the planning board. I'm not sure if it works exactly the same way for preliminary subdivisions, but I would imagine we treat it exactly the same. You know, we're here to really review the water supply and make sure we have adequate waste disposal.
Are these single family dwellings, each of them?
Yes.
from a inspection standpoint, does it seem to fly?
It's sand less than 2 minutes of an inch. It's gonna be fun. It'll be septic. system.
Okay.
I guess some of it will be the size, but that will be up to Stamsky to design.
Sure.
And they look pretty good sized lots, and with the drainage for the septic, that doesn't seem to be a concern, at least from a preliminary design standpoint.
Right, yeah, no, I mean, we're able to keep the septic system leaching areas and the drainage fairly separate here, you know, they're a good distance away, so.
Excellent. Well, if there are no other questions, then I suppose we can vote to approve the proposal. I'll enter. Yes,
Entertain a
or-
motion.
Yes,
Entertain a
thank you. Yes, so I'll entertain a motion to approve the proposed subdivision plan outlined here.
I move to approve it.
Excellent. Can I have a second?
I'll second.
Perfect. And then we'll do a roll call vote. Hi, Portia. Thank you for joining.
Hi, sorry about that.
No problem. Were you there for enough of that to feel you can vote?
Yep,
Excellent.
Yep.
Great. All right. So why don't you start?
approved.
Excellent. Kurt?
Approve.
Great. Dottie?
Approve.
Right. And approved by myself as well. So you have the Board of Health approval.
Thank you very much. Have a good night, everyone.
Excellent. Thank you. All right. So next on the agenda is the Thoreau Junior Tennis Camp variance request.
Yep.
Yeah, if you want to give us some background. Mel?
Yep, I will. In your packet, you have a memo, and it was emailed out shortly before this meeting, to the board from me, explaining that sports camps have a specific requirement in the code. In blue, is the specific definitions and the requirement in question. We had a fortunate experience to have the same inspector do the camp inspections for 20 years. There have been some modifications to the camp code this year, but they're specific around medical and medical camps. Was not anticipating the fact that most of our sport camps are not, if not all of them, are not in compliance with this section of the code 1.151. The code specifically says that a sports camp must have a sign off from a medical doctor on the medications. Most of the physical forms, they're made by any kind of doctor's medical software or reporting, have not, 50% of them say something about medications, but the other 50% have no mention of medications. It does not mean the child is not on medication, it just means it's not in the report. And we went back and forth actually with DPH, because I was, the first camp that came up was a sports camp out of the gate, and we clarified that the intent of the code is indeed for a doctor to sign off on those three aspects, the allergies, the medications, and the physical ability to participate specifically on sports needs to be outlined and signed off on for a child to participate in a camp. So with that, it was pretty tight to the camp season for a number of our camps to comply. We have had one sports camp get that requirement, but we have a couple, and we will have more. We had one today that couldn't make, there's no time, that they are not going to be able to comply. Consulted with DPH, they suggested we put a variance request forward and present it to the board. And the details of what a variance requirements are at the end of the memo. Specifically, they need to write a letter, they need to request a variance, and they need to show that their insurance approves of that. There's a reason called manifest injustice why they need this variance, and that they are providing at least the minimum protections required by the code. With that, I recommend that we go forward and prove that for the two candidates that here. I'll let them present their requests. And I also am going to ask the board to allow me to grant variance instead of in lieu of a hearing for the rest of the sports camps, if they would consider that, because or else we'll be back here for another hearing next week for all the rest of the camps and the week after that. So because of the timeline and their need. So a couple camps have already started. There's a lot of moving parts this time of year.
And Melanie, just to be clear, the variance would just be for this season then?
Correct. It would only be for 2024 with the full intent that we will communicate. Everybody involved will know next year we're going to have the right forms signed off by doctors for all the sports camps. I think everybody that I've worked with so far understands that, and they don't mind complying at all. It's just that the timeline to get a family to get a doctor's note on a medication could be a big lift.
Are you able to define manifest injustice for me?
I would say, to me, that means it's unduly difficult.
Okay. That makes sense.
Right? An
Yeah.
unfair and unreasonable amount of expectation. And in this case, I guess I feel that the health division itself had not been enforcing this correctly. And I have to own that, with the intent to change that, in the future. But to do that in the short notice for some of these camps, it's like next week or now, that would be a big lift and a lot of kids not in camp.
Great.
But I think there's some individuals here, I see Anne Marie, that probably can weigh in and present what they have.
Yeah,
So the
so
first-
thank you very much. We appreciate the opportunity to appear for the variance, and moving forward, we will comply.
So Anne Marie is the camp director at Thoreau Camp, and she's also representing the Thoreau Junior Tennis Camp. That's at the same facility. And then I believe someone from the Patriot Sports Camp is here as well. Let's check. Jackie?
Yes. So for Patriots, basketball and field hockey, we have physical exams for each camper stating that they're cleared for all camp, school, and physical activities. We also have 2 licensed athletic trainers on staff. Each parent has completed a medical history form for their child attesting to their physical ability to attend camp, and our insurance carrier has also approved the variance.
Great. That seems to fit everything.
Thank you.
Yes.
Anne Marie, you had, your team at Camp Thoreau was trained as well. Did you want to talk about that?
Sure, yes. So we also have our insurance compliance. We actually just hired a registered nurse. We have 2 EMTs and an athletic trainer on staff as well.
Excellent. Sounds good. Well, if there's welcome any other discussion from the board,
Any questions?
any questions? Otherwise, I would entertain a motion to approve the variance requests. We could do both the Thoreau Junior Tennis Camp variance and the Patriot basketball variance, maybe in the same vote.
I'll move to approve the variance.
Excellent. I have a second.
Second.
Great. Second from Jim. And then we'll go ahead and do a roll call vote. So Jim, do you want to start?
Sure, approve.
Portia? Kurt?
Approve as well.
Yep, approved.
And I approve. Excellent. So that variance is approved. And then should we also do a separate vote for a variance I would entertain a motion to allow for Melanie, for her discretion, to apply variances to any remaining camps in the same manner at which we just applied to the 2 camps presented here.
Remaining sports camps?
Sports camps,
Sports
yes, thank you.
camps,
Yes,
And for 2024.
for 2024 only. Yes, thank you.
Yeah.
So a motion,
Yep, I
Yep.
motion to accept that variance for the other sports camps in 2024.
excellent. And second,
I second it.
perfect. And roll call, Jim,
Approve.
Portia? Great. And Kurt?
Approve.
Great.
Yep, approved.
And approve. Excellent. So we have unanimous approval. Excellent. Thank you, everyone. All right. So next on the agenda is appointing Dominic James as an agent to the board.
It's Dominique.
Dominique, excuse me. And is he?
Thank you.
Dominique is here.
Oh, yes.
There
Here.
he is.
How you doing? How you doing?
Excellent. Good to see you.
You as well.
Would you like to give some
Dominique
background?
is
Yes.
our inspector that started with us on May 20th. He's been working, doing a number of our camp inspections already. He's onboarded, training. He comes with us with experience from the food industry. He was a pastry chef. Most recently, he did third-party food inspections. But right now, it's all things camp. And we would like you to appoint him officially as an agent for the Board of Health.
Excellent. I would entertain a motion to approve.
Second it.
I, for the motion
Yes.
to approve.
Okay, excellent. And a second from Jim. And yet again, let's do a roll call. So Jim, go ahead.
Approve.
Portia,
Approve.
Kurt,
Approve.
Dottie,
Approves.
and I approve. Excellent. Welcome, Dominique.
Thank you guys so much.
Thank you. Glad to have you.
Glad to be here.
Out
Okay.
of curiosity, how many camps are in Concord? I feel like there's so many.
20?
Wow. Yeah.
There's a lot of
There's a
camps
lot
in
of camps.
Concord. We have a lot of camps. Every private school has, the high school has 5. Camp Thoreau has 2 different ones. It's very separate, like day camp versus tennis camp. There's a lot. I've never been in a town that has as many camps.
Well, good job, Donnie.
I mean,
Gotcha.
we have 5, there's 4 in Lincoln or 5, 4 camps in Lincoln. Because we're the agent for the board in Lincoln as well, but
Mhm.
that's a normal number. I think every kid in the Commonwealth or in Middlesex County is in Concord in the summer. Right, Dominique? I mean, how many kids? It's so many children. and
So
it's
many.
not- They don't live, every camp has like 200 to 500 kids. Also, there's not that many children in Concord. So, and they're all day or sport camps. So,
Melanie, can I chime in? Have you encountered
any residential travel or trip camps with the same issue thus far?
I don't have a residential travel or trip camp.
Okay. Just making sure because that variance would then potentially impact them as well.
Correct.
Alrighty. Well, should we move on to the public health nurse report?
Yes.
Go ahead, Moira.
So for diseases in May, there was one case of babesiosis, a parasitic disease spread by the bite of an infected black-legged deer tick. This is not a surprising number. Campylobacteriosis, one case. This is a bacteria that infects the bowel. And this was a case that had also traveled outside of Massachusetts during their incubation period. One case of encephalitis, the cause of which has yet to be determined. Powassan testing was requested, but did come back recently negative. One case of human granulocytic anaplasmosis, one of the diseases, a bacterial one that is also spread by the bite of an infected black-legged or deer tick. One reported confirmed case of influenza, 9 for Lyme disease, 12 for coronavirus or COVID-19, and 4 for latent tuberculosis infection. And we talked a little bit at my last report about the LTBI cases, none of which are concerning at this point in time. Any questions about the actual disease report numbers?
Sounds good.
So I'll just talk briefly about community outreach. So Dr. Kring, along with one of his colleagues, did provide physicals to about a dozen kids at the emergency assistance shelter ahead of camp season, but work is still being done in coordination with the healthcare coordinator at the shelter, continuing to connect residents with primary care providers. I did give a talk on mosquito and tick-borne diseases at the COA on the 13th of May and attended the annual Massachusetts Public Health Nurse Conference in May. We supported Wellness Week at the Library for Mental Health Awareness Month, providing programming and talks from different experts in mental health and a table with mental health resources. And our local health graduate intern has started and been working with us for a couple of weeks now on the community health needs assessment survey, and work continues with that draft. And that's it.
Excellent. How did Wellness Week go?
So it went okay. I think I went to a couple of the programs that were offered throughout the week, and I would have liked to see attendance be a little higher at some of those programs, but the groups that did attend were very engaged and had lots of questions and were appreciative of the programming.
Cool. Do you know if they're going to continue it next year?
I sure hope so. I think Melanie would agree that we would like to continue to support that. I think with mental health being such a need in most communities, we would want to support continued resources and programming.
Wonderful. And then one request, if it's not too much of a lift, for the disease reports going forward, if you can just add on kind of like the last like 2 or 3 months of data as well, then it'd be kind of helpful to just see kind of how, if there's any trends kind of over time. I think that would be helpful for the board to see. You can just copy
Want it
forward the, yeah.
listed just as numbers
Yeah, that's fine.
like
Yep,
this
maybe
and,
like in
and
the-
show.
In the same column, so like, we
Okay.
can see, right, there were, 12 reported cases of COVID this month, last month, how many were, just to have the data present in front
Sure.
as we're looking at it, that'd be great. Excellent. Anything else from board members for Moira?
Are those standard um Lyme disease or deer tick? I know in certain jurisdictions the rate of tick-borne illnesses is going up, but I'm
So
curious if that-
for Lyme disease and babesiosis and human granulocytic anaplasmosis, those are the three tick-borne diseases that are most common in Massachusetts. And so
Uh-huh.
we do see a good number of all of those Lyme disease being the highest in numbers pretty consistently.
Uh-huh. And is that nine? I don't know why 9 seems low but I don't like that recording captures all of it.
Yeah, so if I look back at, I can tell you the numbers on my end. So the report for Lyme disease for April was 6. For March was 3. There's definitely some seasonality there,
Uh-huh.
but with the temperatures as they are and the less significant winters that we're having, certainly we are continuing to see that uptick in tick borne diseases.
Thank you for the information, Moira. And a good report as always. And we'll, if there's nothing else there, then we'll move on to the next agenda item. Thank you again. All right. So the next agenda item is discussion of the tobacco-free generation regulation. And just to be kind of explicit about it, this is not a formal hearing. This is an information session for the board as we kind of consider how we want to proceed in considering this as something we want to take on. And so Melanie, if you're up for it, maybe I'll have you kind of start with an introduction.
Yes.
And then I did receive contact from Anthony Mishak, who's on Zoom here with us, who has experience with how Brookline proceeded with a similar sort of regulation. So after Melanie's introduction, I'd like to have Anthony speak briefly, and then we'll go on to have a discussion with the board members kind of after that.
Right, and we have a number of other people here in support of, or not support of the
Excellent.
tobacco-free
Sure.
generation, as the case may be.
Indeed.
Lisa, I believe, is the individual from MMA that worked off the wording. So this is our current regulation that we worked on a year ago and updated to be compliant and consistent with the state 2020 regulation. The highlighted portions are specifically about what the tobacco-free generation wording is, which means as on the date, which would be proposed here, January 1st of 2025. Once, if you turn 21, you're still not able to purchase tobacco products. And that would be in perpetuity thereafter. So anybody born after that date would also not be able to provide. So January 2nd, you do, and so on and so forth. Concept being, in 10 years, no one in their 20s is able to buy tobacco products. That's it. That's
Cool.
the summary.
Excellent.
I'm sure other folks have more to say about it. But that's the content of what the change is.
Sure.
But there's a lot more people here with, expertise that can address more concerns or experience with that regulation in their town,
Sure.
that they could speak to that.
So I think just for purposes of moving the meeting along, what I'll ask is that each person kind of limit their comments to 3 minutes, and we'll that's how we've been doing the public comment at the end of the meeting. So we'll just to, again, kind of give everyone an opportunity to speak, but also kind of keep the meeting moving along. So I think, why don't we have Anthony start, since he reached out kind of in advance of the meeting, and then we can kind of go around to any other present members members of the public who would like to provide any insight. So I'll go ahead and start a timer just for completeness sake. And Anthony, why don't you go ahead?
Thank you for the opportunity. Can I just ask one question so I can gauge my comments? Has Mark
Yes.
Gottlieb arrived there?
Yes.
Yes. Okay, so I won't speak to the legal aspect of it then.
Sure.
Perfect. So I am a clinical pharmacist during the day. I work in primary care, taking care of adult patients at high cardiovascular risk. I'm a resident of the town of Brookline, and I was a co-petitioner for this warrant article back in 2020, along with Kate Silba, who's a BU law professor. She unfortunately can't join us. She's actually on a plane. So this was brought forth in 2020 with an effective date for anyone born in 2000 or after. So I come to you today speaking from the perspective of someone who, saw this from the beginning and kind of the barriers we encountered, but also from someone who's lived in this town now for 3.5 years beyond that, and for a total of 17 years. In the 3.5 years it's been passed, we have had no businesses close as a result of this, partially because of how nuanced it is. This doesn't do anything for current addicted smokers and tobacco users. So it's a subtle way of helping to prevent addiction, because as of CDC data from November 23, approximately 90% are addicted before the age of 18. This is less than a year old in terms of data. So we know that if we move the age up, addiction goes down in terms of new users, with a benefit to the society overall. Most of you are aware from a Board of Health perspective, tobacco is addicting. There's a reason that 90% start at a young age before they develop fully rational thought. Most people, around 60% by the age of late 20s or early 30s, regret and try and quit smoking. So we know this is a very brief window and people regret it right away. So from a healthcare perspective, it doesn't do anything in terms of taking away access to care, right? This doesn't impact things like prescription nicotine products. It doesn't take away and punish addicts who are currently using. There's certainly resources for that. And it hasn't impacted our businesses in terms of closures. One could argue now that at the 3.5-year mark and going on, is it really this initiative that could impact things in terms of businesses, when we know there's multiple other factors such as rising rents, and cost of paying employees and other factors? Probably the barrier you might need to think about from a local Board of Health perspective in terms of regulation that we heard from our Board of Health is, when it was a fixed age, you just went and looked for someone who is 20 years old, 21 years old. Each year now you're looking for someone a little bit older, right? So now they're looking for somebody who might be 23 years old to see if they could do it. And so you could envision in a few years, they could look for someone a little bit older. The other biggest argument you will encounter is that you're taking away the right of someone to have this. And this isn't really a right, it's an addiction, as we know. So many people regret it after doing it. And so from a perspective that, people don't have that access. Right now, it's about decreasing access at a younger age until they can fully make that decision on their own, and are fully have the rational capabilities. Thank you for your time.
Excellent. Any questions from the board for Anthony with his perspective there? I would ask, just as a clarifying, kind of just again thinking about the taking away the right issue. The towns adjacent to Brookline do they have different regulations, or have any of the adjacent towns adopted similar regulation?
So Newton is in the process. Theirs would go with the date that you are choosing, which would be to take effect for January 1 of this upcoming year. Anyone who would turn 21 at that point. So Newton is in the process, and we are optimistic that they will implement that. The next nearest town, of course, is Boston and Cambridge. Boston, to my knowledge, has not expressed any dialogue in terms of looking at this, but as you guys are probably aware of, Boston doesn't tend to be the leader in this type of thing. They tend to follow pretty close to the state. Those are the bordering towns for us. So Newton is doing it. Boston, we don't know. Cambridge, I will leave to Mark. He might speak to that a little bit more. But yeah, to that point, that's the bordering towns issue.
And there's, of course, nothing preventing someone from going to an adjacent town. You know, if they could not get tobacco in Brookline, then they could go to an adjacent town. So it does not, it restricts access, but does not eliminate access in that sense. I mean, there's a geographical barrier, I suppose, but.
Yeah, it's a sales restriction. And truthfully, as you probably heard or read, any tobacco policy that has been passed has shown to a decrease in the utilization of tobacco, though we're still not at zero. So this is likely to do the same, that if someone has to go a little bit further, you know, it's likely to serve as a barrier from that perspective. So yeah, to your point, it doesn't really impact them from that perspective.
Do you know if Brookline has done any kind of cost saving analysis relative to healthcare outcomes?
So, you know, for the town itself, and it'll be familiar to you, really the only revenue that you generate from tobacco at a local level is what you charge for permitting. So from a cost perspective, that, you know, if you charge them for a permit and there's a potential of a permit closing, there's that. From a healthcare perspective, we have a pediatrician in our Massachusetts coalition that's like, you know, Mark, myself, and Kate, we have a small group trying to do this across the state. And he's thinking about how to look at that data. As you can imagine, because of the way it's created, it takes years to show an impact, right? Because right now, it's not anyone that's using it, and it might be too early to try and compare one town to the other when we're just starting to get to 22, 23-year-olds.
Right. Okay, thank you.
You're welcome.
Did you have legal challenges when enacting the regulation?
I don't want to cross over onto Mark's toes. He's going to speak about this. We did have a legal challenge, Mark's group. You know, when this idea came about, so we passed the flavor warrant article in 2019. Then Kate and myself met with Mark, who's the attorney for PHAI out of Northeastern, when we had this discussion. They provided legal support for it and then defended it. So I'm going to leave that part to you. But I will say one thing, the reason we decided to do this at that time was because tobacco always adjusts to try and stay ahead of the curve. And it's too hard to try and do it after the fact. So this was a nice way to try and do it within what a local municipality could do, especially now if you're reading the stuff about like Zyn, the Zyn containers and how those are being used frequently. So that was part of the emphasis for that, but we did meet with Mark, and I will defer the legal questions to him, unless he somehow wants me to answer.
Is Brookline a marijuana-free town also?
No, we have 4 dispensaries, and then we just passed a it was, I guess, a ballot initiative that went to the town for the residents to cap it no matter what, because you have to have a ratio fixed to the alcohol permits. And so we're capped at 4. So we have like a restriction from the number of stores, but those stores had opened. To be honest, by the time we brought the flavor thing in 2019, I think we already had 1 store that was already in place and 2 that were already pretty far along in the permitting. So we, you know, the marijuana part had already kind of left the station, as you would say. So we do have a cap in terms of number of stores.
Do you see this as flowing over eventually to smoking marijuana and all smoking products, or is it just tobacco that you're targeting specifically? Or
yeah, so this is tobacco, smoking and non-smoking products, right? Because we know there's not just combustible like cigarettes, but even like vaping, chew, anything like that. This age restriction applies to any non-prescription tobacco nicotine product. Marijuana is a difficult thing because I tried to look into this a few years ago. state laws are pretty tight on what you can regulate and not regulate as a municipality, because I wanted to think about things like, what's called shatter, like the glass type marijuana that looks like glass. It's kind of like those old crystal candies that can be pretty high in terms of concentration. But the state itself really comes down on what a municipality can do in terms of regulating types of tobacco that are sold and those types of products, at least for a town.
Another question for you, in regards to Brookline, does Brookline have a town meeting, or what is the legislative body for the town as a whole? And was that as far as this regulation proceeding, was there discussion to have it kind of presented in front of the town as a whole?
Yeah, so Brookline is town meeting, and so for us, it was passed as a town meeting process, not a Board of Health action. And so we did go through multiple hearings initially. When we proposed this, I had chosen 1976 as a cutoff date for a couple of different reasons, knowing that, over the course of town meeting, it would get negotiated. So not to come with your best offer. And second thing is, there was a New England Journal or a JAMA article that shows, Journal of American Medical Association article that shows right around the age of 40, if you stop use of tobacco, you almost can reverse the curve by the end of, for life expectancy. So we did have to go through the process, multiple hearings with Board of Health, with a select board, with our advisory council, which is kind of what does the financial part and that type. So there were multiple hearings along the way. It finally passed with, I can't remember if it was 63 or 68% of the vote. So it was clearly majority. It wasn't the 90% we did with a flavor, but that's okay.
I have a quick question.
Please.
Can you talk about any pushback from retail establishments, convenience stores, or other places that might have had some concerns?
Yeah, so I will speak to it just briefly, because this again will fall in the area of like what Mark will speak to, since they launched the legal challenge and followed it all the way through. Their concern is similar to what you can imagine, which is like people will just go elsewhere, right? Like if you do it, we're not an island and things like that. That doesn't necessarily work quite as well. Brookline's a little bit different than Concord in that you can imagine we border a lot of schools, right? And so one of the reasons I was proud of this action is because the age of vulnerability, if they don't pick it up here when they're going to BU and Suffolk and those areas, when they move back to Arkansas, Kentucky, they've moved through that window of addiction. So we have a chance to impact kids that move across back to the country. That same point is those are people who often, if they have to travel further, to get something, they're less likely to do it. They usually get it kind of from peers like in the local area. So I don't know that they necessarily went further to get it, right? Because it wasn't like being advertised or sold here, but that was their main concern. And by the end, as in like this year after the judicial court ruling, their tone has changed to, well, the whole state should just do this, right? Like they basically want it so that the level field is, the field is leveled. So we're doing the best we can now to accommodate their requests, right? You guys, I think, would be around the 10th that would be in the process of doing this. And we've got, a handful of others lined up. So that was kind of the resistance. But I'll let Mark speak to the broader impact of what they were questioning.
Yeah, no, I understand the patchwork of the 351 towns can be confusing. But if Massachusetts passes it, will everyone go to New Hampshire? It's like buying fireworks, but that's hopefully all the states will be, getting on board.
There was a article done in Ontario years ago, like a decade or so ago, that looked at comparing Ontario versus a neighboring province, Ontario, Canada versus a neighboring province. See when Ontario passed legislation, did it impact in terms of like the smoking rate? And they actually still saw that it went down, which kind of leads you to believe that like if they passed and the provinces didn't, and yet their rate went down, that still likely means that there wasn't leakage to nearby states, nearby provinces. That's the best data that I've heard of, at least when we went through this back in 2020. I did not see any recent studies at that point that looked at tobacco. There are other health studies that have shown the same thing with like concentrated juices and candies, same thing, that leakage tends to be a little bit lower.
Well, will you or Mark speak to I'm just curious, like the outright ban versus like raising the age to 21. And maybe it's because state authorities regulate liquor and alcohol and marijuana. Can you just speak to, why
Yeah.
nicotine versus those products?
So first of all, municipalities in the Commonwealth of Massachusetts have the right to pass the tobacco regulation that they feel is best because of its public health impact. We chose this more subtle one for a couple of different reasons. One is that for businesses, it doesn't impact them, right? Like these are customers they don't have right now. So from a business perspective and what could have been resistance, this is the most minimal thing. No money is being lost to them right now. From a perspective of impacting people who could have been vulnerable, doesn't impact people who are addicted. And right away, you're trying to force them. And if they don't have the access or the ability to be able to quit, this is more compassionate. As much as we want them to and we want to encourage them, we need to meet them where they are. And this would have made it a little bit harder for people who are readily already addicted. And three, and this is where your town much better, whatever will pass from a public health perspective for tobacco, that's what you need to pursue that will pass and make an impact. There are towns that they probably know the political landscape and they could pass a ban and do that. Certainly around the US, we've seen a handful of towns do it, but you want to do an action that will be impactful. And this is one of those that's slow. And then if you decide after a year to come back, then that's always an option you have available. But the biggest impact is stopping new addiction first, and then trying to focus your other resources like medical resources, education resources to the people who are already addicted.
And yeah, just so I'm clear that the phase out is like eventually when that target hits, it's 0, right? Like once whatever the date in certain is, it's no sales versus
Right, in
Yeah.
100 years, there'll be, in
No one
100
can
years,
buy it.
no one will
no
be.
sales, yeah, versus
Yeah.
like liquor
Yeah.
where the
Prob-
age is higher. Well, right, versus liquor where the age is. I'm just wondering, and Mark, maybe if you could speak to that, like in terms of the legal challenges, if
Yeah,
there's
what are
any
we,
distinction between 21 versus like an all out ban eventually. You know what I mean?
Yeah, I'll defer the legal part
Yeah.
to Mark again. From a healthcare perspective part or the numbers, what I would expect is that predominantly, as you can imagine, there's really like a couple of ways out of tobacco addiction, right? Like you either stop or it gets from what I remember with the numbers when I was looking at that quit rate and thinking about using the age of 40s for the initial proposal, I think it's something like really your biggest capture is by the age of like 40. You could probably capture, something like 2/3. So realistically, if you were to pass this or if the state were to pass it, I would envision in the next 15, 20 years, the numbers would be like so small that it basically would just set you up to just like, pass a ban and just tip that last domino over. So usually it's something like 65 to like 70% of smokers on the broad data are under the age of 49 or so.
Well, for the sake of moving the meeting along, why don't we recognize Mark? Yes.
Yeah, Mark Godley, Public Health Advocacy Institute at Northeastern University School of Law. I have been working on this policy for a number of years, maybe a little more than a decade or so. So I was thrilled when Kate and Anthony came to my office a few years ago with looking for some kind of phase out for the town of Brookline. And my organization had made the offer broadly to any municipality in the Commonwealth to defend any legal challenge were one to arise, which it inevitably would, were a city or town to pass this policy. But Brookline actually went ahead and did it, and of course they were sued by retailers, and fortunately, we were able to represent the town pro bono and successfully defend the bylaw. The retailers had two legal arguments. One was that you know, just in 2018, the Commonwealth changed the minimum sales age for tobacco products to 21 from 18. After a number of, a fairly significant number of cities and towns had one at a time and piecemeal process done just that. Eventually it reached a point where it was time for the state to go and do that. So they argued that state law preempted the Brookline bylaw. They also argued that made what's called an equal protection argument, that it violated the equal protection provisions of the Massachusetts Constitution by creating two classes of people in an unconstitutional manner. And you know, you had asked whether this was a town meeting or a Board of Health process. Fortunately, it was a town meeting process, and a town warrant, when it's approved, it must be okayed by the municipal office of the Attorney General. And so the AG's office looked at this specifically with the question of whether it was in conflict with state law. And the preemption question, and they came back and said, no, it was not, which had a Board of Health done this, that we wouldn't have had that record created. You know, which I think put us in a better legal position, a stronger legal position. But the Superior Court judge agreed that it was not, that in fact this furthered the purpose of the minimum sales age law of 21 rather than interfering with the legislative purpose. And they didn't find any merit to the equal protection argument as well. And if I could, just one quick thing, you know, I don't think with this particular policy, we're going to see people running, were it to pass statewide, people running to New Hampshire, because it affects a population of non-users. Unlike the flavor restriction, for example, where you had, you know, thousands and thousands of people buying flavored tobacco products, they still wanted them after the state restricted their purchase, they would go to New Hampshire. This is affecting people who are mostly nicotine naive and not addicted. It's creating the next generation as tobacco and nicotine free. And because of that, I don't think we're going to see the big cross-border problem that we've seen with other types of sales restrictions.
If I can ask, the suit, was it from businesses in Brookline that sold tobacco? Was that?
Yes,
Yeah.
just I think it was 7 or 8 licensees or permits, the tobacco sales permit holders that brought the action.
Got it. And I'm guessing that the precedent of the legal action may potentially prevent a suit from.
Yeah, those, I think the path forward for any municipality to adopt this is now clear legally throughout the Commonwealth. In other states, it could be a different situation, but those were really, I think, the only legal issues that could be raised. If any others were, our offer continues to stand, and we would be happy to and honored to defend any town that incurs the wrath of retailers. And you know, and retailers aren't the bad guys here. You know, often tobacco products actually get into young people's hands not through retailers, but through older peers. And I think, as Anthony eloquently mentioned earlier, over time, this policy will increase the age gap between those who can purchase and those who are in high school or middle school, such that, you know, you'd have to find people in their 30s to find you the vapes or other tobacco products you're looking for in middle school, and that becomes less and less likely over time. And this will actually have an impact on reducing underage tobacco use and initiation.
That's awesome. To the effect of, that there is legal precedent for this. You mentioned that a town meeting vote in the case of Brookline was helpful.
Particularly for the very
For the
first
first one.
Yeah.
But now kind of perceiving that that is present, would that additional kind of protection from a town meeting vote standpoint maybe not be as necessary? If that, I'm sure like the specifics.
Yeah,
depend,
no,
but yeah.
it's.
I'm getting at, the Board of Health approving rather than going through town meeting.
Yeah, it's now any Board of Health and can, and now we've have 6 that have already approved this, and there hasn't been any sort of legal repercussion that we've seen thus far. I really don't expect any.
Got it.
Can you just list the towns that have?
Yes.
Actually, they're
They're
here.
from towns.
Yes.
Hi, so Maureen Busby, I'm the Regional Tobacco Prevention Program Coordinator for 7 communities: Malden, Medford, Melrose, Stoneham, Reading, Wakefield, and Winchester. And of those 7 communities, 6 have already adopted this policy. So all but Medford, and Medford just had a public hearing today at noontime. So they haven't voted yet. All the boards that did this had a public, I did a presentation, then they had a public hearing, then at a subsequent meeting, they voted. And I know you started the timer, so I'm gonna very quickly show.
Sure, yes.
So I ran home from work and I made 10 folders and I left them somewhere. So I have exactly 2, but
Okay.
this will be enough.
Sure.
I won't spell out for you all the legal stuff. I just want to point out to you some photos
No, I'm fine.
in that, and I have them for you, Melanie, I'll find them. So when I'm talking to a board, I kind of explain, one of the reasons that we want them to consider this is because we've done I've been in tobacco prevention for 13 years. I've worked with cities and towns, policy after policy. The legal minimum age, permit cap, cigar minimum price, flavor restrictions, and so on. Great, I'm proud of that. The boards were great, Band-Aids. Every year, the tobacco industry comes out with new products, and that's what that is meant to show you.
Mhm.
If you haven't seen Zyn, Zyn is a brand name, but if you haven't seen pouches, that little Ziploc bag on the front cover, those are pouches. And then I have a picture of some of the Zyn supply that I see in stores. Zyn has taken over cigarettes. When people reject this policy, say people aren't smoking, they're right, people aren't smoking. They're either vaping or they're using Zyn. And a tin of Zyn, there are different strengths, but a tin of Zyn has the nicotine value of 2.5 packs of cigarettes.
Wow.
2.5 packs of cigarettes in Massachusetts costs about $35, which is a good thing. A tin of Zyn costs $5.
Mhm.
Except today, when I wanted to make folders for you, I stopped at a store and Zyn is in a worldwide shortage right now. And I bought 4 tins of another brand, 20 in each pouch. And again, this comes in different milligrams. And I bought 4 tins for $17.38. So it's way more nicotine than in a pack of cigarettes. So when we talk about it in our boards, we're talking about what the industry is doing to prey on young people. You can see the highlighter vapes.
Yeah, these are highlighter vapes.
Those are vapes.
Okay.
And luckily, we don't see many of those in Massachusetts because of the flavor ban, but I've had a colleague order them and be able to get them online. And a teacher, a parent seeing that in a kid's backpack would never know. So the tobacco industry has a playbook. They're repeating the plays in that playbook. Cheap. Zyn is more discreet than vaping. We had a hard time recognizing vaping. We have a really hard time recognizing Zyn because they put that little pouch in their mouth and your saliva dissolves the nicotine powder. It's nicotine salts, which is a quicker zap to your brain. Well done.
Well done. All right, yeah. why don't-
Hi, my name is Anthony Choi. I'm gonna take a little bit, I'm not gonna rehash everything that was talked about tonight. I'll take a couple seconds to recognize that I worked with Melanie for some time. I miss working with Melanie. Melanie was great to work with, so I'm glad to see you again. So I am the health director for Melrose, Wakefield, and Stoneham. 3 of our communities that have passed nicotine-free generations. Stoneham was the first to do it in our group, and then followed shortly by Wakefield and Melrose. Something that we wanted to emphasize was this policy. We did this with the idea of, after talking with our schools, talking with folks that work with youth, this is a protection for them. And we wanted to prevent, close that window of them getting addicted in the first place. I think two of the arguments that we've heard a lot of, and the vast majority of our hearings that we've had, the opposition has been heavily from the industry side. To no surprise. There's a lot of arguments about how vaping is safer than cigarettes. There's a lot of arguments about how pouches are safer than cigarettes. And I think the biggest thing that we want to get ahead of is, those statements just aren't true. And businesses face, economic incentives to sell, right? So it's almost like they're talking about taking away their own customers, but they're in turn actually creating a stronger customer base. The only way for them to survive is to continue to generate new customers, and the only new customers that are coming are youth that are growing up into those places. So for us, it was important to address that, and hearing all the stories in the schools, how they're losing the battle of vaping in the bathrooms, how bathrooms have to be closed entirely because they can't be monitored by a number of teachers and staff. It was very important for us to look at this and say, what are we doing to help prevent that? And like all the policies we've done before, it helps to minimize tobacco use. This will help push us in the right direction. And it's been said multiple times tonight, but affordability and availability are the two big drivers for substance use. And that's not just tobacco, but tobacco is not exempted from that. So in the sense that we can limit availability, it's very important for our public health mission.
Awesome. Excellent. Any questions from the board or anyone who's spoken so far? Excellent. Well, thank you all for being here and for all of that information. I guess we should, as a board, discuss kind of how we want to proceed with this. So would it be as simple as, or I guess, so the next step would be to modify our existing regulations?
Right, this is a
Yes.
proposed draft.
Okay.
And what I need to do is work with town council on finalizing the draft.
Okay.
I would like to work with our tobacco control agent. There's a couple other tweaks in here that I'd like to address. He's brought forward to me that need to make it more streamlined and articulate.
Mhm.
Specifically around the fines. We didn't address that the first time, and the duration of tobacco suspension. So we have a precedent, but we don't have it in our reg, the duration for second, third offense of the suspension. We didn't articulate that, and we've had now 2 in the last year, compliance checks that have been caught. So just to establish, I guess, like what that is in the regulation, so we're consistent. What I'd like to do, if we can, and then it would be the timeline to post. So if I can do it by our July meeting, or it will be our August meeting to have it be a public hearing, is whether or not I can get the timeline to. And I would probably suggest we do that, have the hearing be in August. We don't meet in August, September. But we have to make sure we have minimum 2-week cycle before the board meeting for posting.
Sure. That sounds like a good plan to proceed from my perspective.
Okay.
Excellent. Anything else from the board in regards to this discussion or thoughts on that plan for proceeding? Wonderful. Very well, if there's no additional discussion, then we'll close that section of the agenda and proceed. And thank you to everyone for being here. Thank you, Anthony, for attending, and we really appreciate the insight from everyone. Very helpful. Thank you so much.
Thank you.
Thank you
This
for
was
allowing us.
really
Absolutely.
interesting.
I'll bring you back.
Okay, that'd be great.
Yes.
Oh, yeah, I'll
Yeah,
take,
sure, yeah.
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 She'll
take it.
find me.
Yeah, that's right. Yeah, exactly.
Good thing there.
Yes.
I've heard about
Yeah.
Zins. I have a
Yes.
teenager in high school.
Oh, boy. Yes. Thank
Oh,
you again.
yes.
Yes, take care, everyone.
So, at the request of the town clerk's office, which is administering for the board, select board. We've been charged with identifying who would be our 2229 Main Street Oversight Committee liaison. So right now, Kurt is our 2229 Main Street Task Force liaison. But we do not have anybody at the 2229 Main Street Oversight Committee. And that is part of their charter. that somebody, a representative of the board, doesn't have to be a board member, but somebody that then would then come back to the Board of Health. Be on that committee.
And can you clarify the difference between the two? So there's the oversight committee and then the task force.
The task force has a finite charge and purpose. Kurt can probably articulate more, he's on it. The task force is a standing committee that would conceptually is in perpetuity because it is the big picture over the whole thing. They've been around for 20 years. But
Yeah,
there is,
sorry, I was just gonna add to that. The oversight committee is really doing technical oversight of what EPA and its contractors are doing to clean up the site. And the advisory task force is tasked with helping advise the town on whether and under what circumstances it could potentially acquire the site after it's cleaned up. So just kind of different charges. And the task force that I'm on ends at, I think, on Halloween of this year. The other one goes in perpetuity until the cleanup is done, which is at least several years out.
And the oversight committee, would that potentially cease to exist after that point also, as if the site is kind of done, or is it kind of unclear?
I think it'll continue at least for 5 years is my guess. These kind of cleanups go on for a long time, and even when they're done, so to say, there's still ongoing obligations to monitor and make sure what they call institutional controls to limit exposure are in place, and they're working like they should. So it may be less frequent, but it'll probably go on for a few more years after that.
so in this case, 229 Main Street has monitoring wells and a well source is being pumped to clean the to pull the water away from the Acton well. So I anticipate that at least it might not be a committee that right now they're meeting about once a month. They had not met in 8 months, for example. So I don't know their long term, they might not meet. It might not be a monthly meeting. It is going to be for the short term, but whether or not they are long term, that's I would anticipate that eventually it will be less frequent.
Got it. So for this agenda item, we need to identify, and so again, it was it's part of the charter for the committee that there is a representative that communicates to the Board of Health. Is that
correct? That
Okay.
kind of reports back to the board about what's going on at 229 Main Street, and there's a connection between the two.
Got it.
Is my take on that.
Sure. So I guess, is there anyone on the board who is interested in that?
I'm interested, it's just from a timing standpoint. I'd rather wait until the other 2229 task force is done, just from ability to manage work, home,
Right.
volunteer stuff. I'm kind of running out of bandwidth, to be honest.
Makes sense.
I would imagine it would be beneficial for it to be someone with a sort of cursory understanding of environmental regs, right? I'm just thinking, I don't know. For me, I don't know if that would make sense, but I do have a few folks in Concord who are in that space and another networking group, so I might speak to, but if that's something.
It could be the Board of Health designees, my understanding.
Mhm.
It could, but then they would have to then come to the Board of Health meeting.
Oh, right. First.
Like, so we need, or else we give a report, like there's some sort of
It
connection
has to be communicated.
to the Board of Health, so that the Board of
Yeah.
Health knows. So that's
I see.
I communicated that to the select board office, the town clerk, that I believe we had somebody, but not until the fall. But
Got it. So, and I guess, so Portia, do you think any of those people you know who might be interested, would you be up for reaching out to them, or do you think that
Oh, yeah, absolutely. Yeah,
so maybe,
I'm happy to reach out. I mean, I'm happy to do it. I don't know much of other than what I do in my day job. Attention diligence. but-
Having a hard time with hearing you, Portia.
Can
Do you
you
want
hear me?
a
that's
little,
better,
little
yeah.
better,
Okay.
yeah.
I was gonna say, I don't know much about this space, but if that's not a prerequisite, I'm happy to do it with the caveat that if it's a monthly meeting on top of this, then it might be tough, but if the cadence does slow down, then I'm happy to do it.
Right now it is monthly. Right now they're meeting Fridays at 11.
Do
My
you know if it
understanding,
has to be in person or if it's via Zoom?
they're hybrid. They're hybrid.
Okay,
They meet here at
Fridays
1:30.
are okay. Why don't I see, I don't know if anybody here knows Peter Beatty. He's in, this is what he does. He does environmental regs. I will talk to him. If he's not interested, I'm happy to do it.
That would be great. Excellent.
Thank you.
Cool. Wonderful. All right, anything else on that topic from the board, or otherwise, we'll go ahead and move on to the chair and board member reports. Excellent. So I don't have very much. Let me just pull up my notes here. Aside from you all should have received the email about the draft environmental impact report letter from the chairs of the boards of health of the towns of Bedford, Lexington, Lincoln, and Concord. That was submitted last Friday at the deadline for comment. Thank you all for taking a look at that, and that seemed like a good move. I was happy to be involved with that. And then the other minor update I have is that tomorrow I am again doing physicals on camp physicals on shelter residents in Concord. These are from being shuttled in from Auburn, apparently. But
Wow, you're
yeah.
really serving the whole
Yes.
state.
Yes, right. But yes, it was not a heavy lift, and you know, want kids to be able to attend camp. So just to share with the board that I'm doing that tomorrow. So
That's so nice. That
Yes.
makes sense. So
well,
I
and
hope you don't have to keep doing it for maturity.
agreed. Yes, but it went very smoothly, and I'd like to thank Moira for helping coordinate last month's clinic, if you will. And yeah, I think tomorrow will go very well. So excellent.
It's highlighted, I guess, a huge need that it's on my radar of how to impact, but the access to pediatric care is a real problem. The barriers for insurance, types of insurance, just openings, doctor's office taking new patients or patients that required interpreters as really showed that we don't have the capacity like to serve this at-risk population. It's been kind of eye-opening. I just thought everybody could get to a doctor, like this is Massachusetts.
Right.
Right? And the truth is, no, it's many of our shelter residents have lived in Concord for a year. And they can't get in, get to a primary care provider for general well-being. So that's kind of a big picture problem.
Indeed.
But we don't want them to sit in the shelter anywhere in the Commonwealth and not get to go to camp because they don't have a camp physical. So
Yeah.
Dr. Crane, you get a gold star from me.
Excellent. And that
I'm sure
concludes my report. So yes.
Yeah,
let's
I'm
do
sure
it.
that's
Yes.
valuable to
Yes.
you, that my gold star, but it is really, I think, really special to be able to go to camp, and
Yeah.
DPH is not flexible with that.
Yeah.
In my experience, I tried last year to be like, come on, let the kids be outside. We don't
Right.
want them in a one room sitting there, and no, they did not.
Before you do a report, actually, just looking at the agenda, anything from the other board members to share? Great. All right, hearing none. Go ahead.
All right,
Excellent.
I am ready. So as we discussed briefly, we are into camps. We are mostly through pools. Concord has about 25 pool permits. Indoor, outdoor, semi-public, public pools, and approximately 20 camps. About midway through the camp inspections. We have 4 beaches that have been permitted right now. DPH Beach, if you Google DPH Beach, you can find the portal. It's a new portal the state has posted. Walden Pond is closed due to bacteria. White Pond is open, and you can see the results. We are, Ebony and I, but mostly Ebony, is entering those in the new portal. So that's very transparent. The town beach is this week because of the heat and the pressure, because Walden is closed, only going to be open to permit holders. So if you live in town and you get a permit, they usually have day passes, which is anybody can come in and use, but they're not going to entertain those. Also at White Pond today, they moved, John Higgins from Higgins Environmental moved the A-Pod. So if anybody talks, Jim, he moved the A-Pods to Thoreau's Cove. That is part of, they were kind of further, I don't know what direction, away from Thoreau's Cove, more towards the farther edge of the pond, away from the town beach. But the natural wind flow, it is the best place to have them is in Thoreau's Cove. We will be replacing them. Natural Resources is getting CPC money to put in a more long-term permanent thing called an A-Pod or Sentinel pod that we will be maintaining as a town. REC is being very gracious and gonna learn how to install, maintain, observe, and take care of that as a long-term sustainable way. I've had a little bit of questions about what are you doing about cyanobacteria? And the answer is there are not an obtuse amount of, there's cyanobacteria present, but there's not, it's in part of the natural ecosystem. The pond currently is in imbalance. It's in balance. It's not, they removed so far this year over 400 pounds of pollen.
Wow.
Using the, the theory is that was contributing to the growth of the microcystins, which is one of the the cyanobacteria that produces the toxin. That was probably prohibiting the rest of the zooplankton and pond culture they were taking over, and that is why we're maybe having some of and that removal of the pollen has really made the pond be in balance. So really hopefully optimistic, no sign of cyanobacteria, no growth at this time. So I was there today with John and REC department, new people at REC, just reviewing what we look at, what we see. We are prepared if anybody asks to do testing, to test for the toxin, to send away for toxin, if we need to, but we're not at this time. Also had that one case, I had a couple people still inquiring about the swimmer's edge. But I haven't had any other reports of that, and it's not a concern at this time. That's anything about White Pond, beaches, pools, camps so far. So that kind of is our environmental health summary. Moving on to emergency preparedness, last week at the Food Public Safety Building, we did host a regional CPR training for anybody in the MRC or the Medical Reserve Corps. We do have a new regional MRC coordinator and a bigger picture Middlesex County MRC coordinator, hoping to recruit for the Medical Reserve Corps and start getting our Medical Reserve Corps up and running. We'll see how that goes. Morrow today attended a training on heat safe shelter training and heat safety. Tom Judge is there hosting tomorrow. The shelter is going to be at the Harvey Wheeler for a cooling center. That is going to be staffed by town staff. It's a holiday tomorrow, but they're going to keep that building open. Today also, we went to, I did not, but Mike went to 768 Elm Street site meeting. That's the paparazzi site where there's gonna be 3 restaurants and a bank. We do have a revised plan for the on-site wastewater there, because that system is in failure. We have an approved septic plan. We probably will permit in the next week, and, we don't have any food plan reviews yet for the businesses, but we would probably sign off on the demo permit so they can begin that work. I have been attending occasional 250th planning. There's a lot of activity, a lot of committees planning and considering the town's participation and what will happen for the 250th celebration on Saturday, April 19th, 2025. The difference is for all of us is it's on Saturday.
not Monday.
So traditionally been on Monday, but because of the competition of resources for the marathon, right? We can't divert all the medical like shared services and mutual aid from the marathon based on the resources needed for that. So the parade and festivities and everything in Concord will be, and Lexington and Lincoln will be on Saturday. Easter is on Sunday.
Oh, God.
Passover is in there at the same time. Okay, so we're trying to make as much, and the important thing to keep in mind, and I will at the time period help you, ask you all to help convey to this, is the road closures. The parade will not be the traditional route. And because of the anticipated volume, there is going to be extensive, starting on Thursday and Friday, blockades and soft closures, and that could impact many residents. Okay, so I'm sharing the word. Where we come in is the Board of Health, is we permit food trucks, right? We're responsible for temporary food events. We also are asked to weigh in on things on accessibility to water, trash, toilets, anything to do with the public and health, as you can imagine. Okay? Any questions on any of that?
Emergency medical care, 2 tents or whatever.
All of that is part of it, all emergency medical care, the resources, the staging for all those people, the command center, where that's gonna be, how all the people that come in, if the president comes, what that one, in because he's been invited, the King of England has been invited.
Really?
Yes, yes, and what that impact will be for Secret Service and what it'll look like, we have no idea. Everybody in the health department is on short notice that they anticipate working that day. I don't know in what capacity, and maybe I can rescind that, but I told everybody a year in advance. Please plan on working that Saturday. I might have to recruit volunteers from the Board of Health, so you're also now on notice that if I need help on that Saturday, you're on the list.
So I won't be available to work in the emergency department that day, because I have to help the Board of Health. So I can't.
Support the Board of Health.
I will say it's also my daughter's 5th birthday, so we can
no.
tell her that if she participates,
Oh my
that it's
God.
her birthday party.
I get to meet the King of England on your birthday.
Yeah,
don't know
exactly.
this. All of this is, you know, for me, important, communication with the business. And how that impacts the business community and what information they need to be aware of for deliveries, trash, all that sorts. So that's all kind of in the works. I anticipate having a deadline of February 1st for all applicants and mandatory meetings with communication. This is what, that's kind of the model that the Topsail Fair uses, I'm all familiar with, for a mass food event. How do you handle that? Well, you have a deadline for apply, you communicate to the committee. These are who's applied. And that's it, baby, you know, like, you can't just, you know, traditionally we have people come in, you know, kind of straggle in the last 2 days before the parade, and I told everybody. And I think everybody agrees, like, that's not reasonable, with all the moving parts and where they might be located. So that's just not gonna happen. So, and then mandatory communication meetings so that it is helpful to everyone involved, that, you know, we all know who's here, who's what, who they are, if they need to be checked, how they can come and go, like, I don't know how that's gonna work.
Town meeting is probably the following week,
Who
I
knows?
guess, right?
I
okay.
imagine.
So just thinking about the, backing up to the tobacco reg, just for us to keep in mind if we're gonna have that be a town meeting.
So you're gonna be town meeting vote, you will be asking a lot of your health director,
Right.
yes.
Yes, yeah.
But that's okay, we're in it 2 minute.
Yeah. My, just as an aside, my hope is that, hearing Mark's input, that does not seem to be legally necessary, well, obviously for future discussion, but that it may not be necessary to have that be a town meeting.
Right, what I've heard is some other town, is that something, and that's up for this board to decide,
Mhm.
community-wide, you feel better having the community vote on that?
Sure.
Or do you want to implement as a board?
Mhm.
And that's kind of like, you could then, support it, bring it to
Mhm.
town meeting
Right,
as a
right.
board,
Mhm.
right? So that's that's
Sure,
part,
yep.
one of the considerations.
Just as a scheduling aside.
So I
Yes.
did get interviewed by the Concord Bridge that was in the paper last Friday on Watson virus. I did have great support, just for the record, for Dr. Katie Brown, the state epidemiologist, for the content. So that was a little bit vetted. But she had great support, and I felt that the reporter did do a nice job. I requested that I didn't know the person's name. I didn't share the person's
Mhm,
name,
mhm.
but that there was some good information I could share about tick-borne illness prevention
Nice.
and trying to spread that word. We did conduct Giroux Park is a park, on Commonwealth Ave, across from the prison, next to, on Warner's Pond. That septic system was installed by the town. It's been those bathrooms have not been open for a long time. The bathrooms were open this week or end of last week. They are open. The COC is issued on the septic system. Last Tuesday, we did do 2 deep holes and a perk in the reserve. So in the design and construction, the deep hole and perk was not done in the reserve. And that is necessary in the code. So we did do that. I had a soil evaluator engineer, had do stat engineering, was the soil evaluator, Mike observed. So if anybody has any questions on that, you can definitely email me. The other thing, we were working hard, more mentioned it briefly, but we're working pretty hard on a public health needs assessment. And I am going to ask, I can email it to the board, the draft, there's few questions, feedback, that once it's finalized, to help disseminate. We want as many people to participate in this as we possibly can, to get representation from the town and from everyone. So I am really going to ask, talk to your friends, talk to your neighbors, talk to your neighbors' neighbors. Like, I'm gonna ask everybody to really help disseminate that needs assessment. It'll be open. We anticipate, the goal is around July 1st. We're not, and we'll have it open until sometime in September. Right, Maura? Yeah, she says yes.
Is it an online survey?
It will be it'll be
Online,
all of the
okay.
above. It's gonna be online. It's gonna be app on a phone.
Mhm.
It is going to be in print. Because we
Okay,
have
good.
separate demographics that
Yeah,
need, and that's one of the tasks of this intern. He's a really dynamic guy. It's very fun. If we needed, we could have him come to the Board of Health meeting, but we're trying to keep him focused on getting this. Today we have a collaborative, so we have a behavioral health collaborative that met today, and he presented at that. So to work on that, and that's part of the opioid settlement monies work, to define and understand the substance use and opioid use, and then help inform some of our work. We are going to enter an agreement with a substance use prevention coordinator with our region. So our Great Meadows Collaborative, so Sudbury, Lincoln, Weston, Wayland, Bedford, Carlisle, they're all going to share a substance use prevention coordinator and put money from our opioid monies towards that. And the last thing, I have a housing case that has gone had an administrative warrant. And I did an inspection there last week. That will most likely be a hearing on July 16th. So, the hearing will be before you. We'll have that time, my inspection from, I didn't bring it today, but my inspection report and the order letter from last week. And, be asked to do a finding and decide if the home is unfit for human habitation and is warranting condemnation in order to vacate. I don't know anything, how compliant or what's going to happen between now and then. I will be doing an inspection prior to the meeting again, so I'll have up-to-date information. But I wanted you all to know that that was on the horizon.
Can I ask a quick, is it a single family?
It's a single family, yes, home.
Okay.
Can everybody see me? I'm getting internet is unstable, hopefully.
Portia accident, well, Portia had to disconnect too, so I'm not
Oh,
sure.
there's something weird with the internet. Any questions on anything I've said or about anything else in public health in the community?
Thank you for all you're doing. It's a lot. Yes.
Oh, it's been a
Yes,
good
yes.
team. I feel like we've got a good team. We got Dominique and Maura and Ebony and Mike, and but we have been this month at capacity.
Yeah, yeah.
It's been really busy. Everybody's gone. We're out all the time. And there's a lot of different things that keep coming up.
Hmm.
We just think something else comes along.
Right. Excellent. Well, I think this was a very excellent meeting. We got through a lot of content. I don't see any members of the public present, so seeing no public present, we will pass on the public comments period. And so if there's nothing else, then I will entertain a motion to adjourn the meeting.
I move to adjourn.
Excellent. And second,
Second.
great. All in favor?
Aye.
Excellent. All right. Thank you, everyone. Yeah, and we'll see you next month.